Hello, everyone, and welcome to our presentation on engaging and leveraging community-based organizations in your crisis system. To allow for additional sign-ins past the hour, we'll start the session in about 2 minutes. Good afternoon. Thank you for joining today's presentation on engaging and leveraging community-based organizations in your crisis system. My name is Dustin Bartley, and I'm a senior policy analyst with the Council of State Governments Justice Center. I'll be helping to facilitate today's session. Please note that please note that this session is being recorded so it can be shared with others who could not be in attendance today. We'll also email a link to this recording to each attendee once it's posted on our website. Today's session is being hosted by the Council of State Governments Justice Center and is funded through the Bureau of Justice Assistance. Next slide, please. Here's a brief outline of today's presentation. We'll start with introductions of our speakers and then provide an overview of the Bureau of Justice Assistance, the Council of State Governments Justice Center, and the Justice and Mental Health Collaboration Program. We will then hear introductory comments from the National Alliance on Mental Illness, or NAMI National, followed by presentations from representatives from NAMI Ohio and NAMI St. Tammany. Finally, we'll hear from a recent grantee about the work of his recovery community organization before allowing some time at the end of the session for questions and answers. Due to the size of today's audience, we will ask that you use the Q&A function to post your questions. And due to the number of speakers, we'll plan to address questions at the end of the presentation once each of our panelists have shared. Next slide, please. Today, we are happy to be joined by a number of speakers to help us better understand the work of multiple community-based organizations and their impact on crisis systems of care. Dr. Brooke Mount is a senior policy advisor in the Justice and Mental Health team at the U.S. Department of Justice's Bureau of Justice Assistance. She oversees the Justice and Mental Health portfolio, which includes the Justice and Mental Health Collaboration Program, the Connect and Protect Law Enforcement Behavioral Health Response Program, and the Collaborative Crisis Response and Intervention Training Program. Dr. Mount is a recognized subject matter expert who holds licensure as a licensed professional counselor in the District of Columbia and has dedicated almost 2 decades of her career to developing evidence-based assessment and treatment protocols for individuals involved in the justice system. Beyond her contributions to the BJA, Dr. Mount shares her knowledge and passion as an adjunct professor at the University of Arizona and Yorkville University. Jessica Tornabene. Jessica is a graduate of Western Illinois University, where she received 2 master's degrees in law enforcement and justice administration and in police executive administration, as well as a bachelor's in psychology. Prior to coming to NAMI, Jessica worked as a project manager for state and local governments, implementing Department of Justice grants on a wide variety of issues, including opioid use disorder and victims of crime. Approaching her 3-year anniversary with NAMI, Jessica is currently the Senior Manager of Justice Diversion at NAMI National, where she works on various initiatives across the organization related to the intersection of mental illness and the criminal justice system. Luke Russell. Luke assumed the position of Executive Director of NAMI Ohio in July of 2022, after beginning at NAMI Ohio in June of 2020 as the Deputy Director. Prior to bringing his talents to NAMI Ohio, Luke served as the Director of Government Relations and Public Affairs for AARP Ohio for over 17 years. Prior to that, he worked in leadership positions in mental health and developmental disabilities organizations. Luke leads the NAMI Ohio team to enhance the quality of life for individuals with mental illness and their families. Luke is a graduate of the Ohio State University and holds a master's degree in health administration from Ohio University. As the nephew of someone who lived with schizophrenia his entire teen and adult life, and the father of a son with developmental disabilities, and a brother-in-law to an individual with bipolar disorder, Luke is devoting his professional and personal values to assuring NAMI Ohio's success and carrying out its mission in the years to come. Nick Richard. Nick has served as the executive director for NAMI St. Tammany since 2008. In that time, he's built significant community partnerships between local lawmakers, hospitals, law enforcement, the criminal justice system, and community leaders. He has served as a mentor during the formation of the Crisis Intervention Team, or CIT, for the St. Tammany Parish Sheriff's Office, and is currently the co-chair for his community on the CIT Steering Committee and is a certified CIT coordinator. Mr. Richard is an active member of the community and is involved in initiatives that work to improve services and resources for families and persons with mental illness. Recently, Mr. Richard was awarded the 2019 Vicky Cottrell Leadership Award through NAMI National and the 2020 CIT Advocate of the Year Award through CIT International. Bill Carruthers. Bill is a certified psychiatric rehabilitation practitioner and certified peer specialist for mental health, addictive disease, and full health, who has worked locally and nationally with state and local organizations, behavioral health agencies as a service provider and program designer. As CEO of Recovery on Fire, he has done hundreds of presentations and workshops designed to lend a recovery voice and share the value of lived experience to the recovery transformation of our existing systems. With ongoing commitment, dedication, and engagement, it is his firm belief that Recovery on Fire can determine areas for opportunity, furthering empowerment and recovery-oriented outcomes, and implementing aggressive communication and training platforms to complement the good work that is already being done to create model recovery for all parties concerned. Next slide, please. I will now turn the presentation over to Dr. Brooke Mount, a Senior Policy Advisor with the U.S. Department of Justice's Bureau of Justice Assistance.
Thank you very much, Dustin, and hello, everyone, and welcome. Again, my name is Brooke Mount, and I'm a Senior Policy Advisor here at BJA. I just want to tell you a little bit about BJA. We collaborate with our national partners to assist states, local government, and behavioral health organizations to better understand the relationship between the criminal justice system and the mental health population, as well as to create policy and programming that meets the needs of municipalities and the citizens they serve. The Bureau of Justice Assistance is located within the Office of Justice Programs, or as you may know it, as OJP. OJP provides a wide range of services to the criminal justice community in the form of grants, training, technical assistance, and research. OJP is actually one of 3 grant-making components of the Department of Justice, along with the Office on Violence Against Women and the Office of Community-Oriented Policing Services. Next slide. The Bureau of Justice Assistance was created in 1984 to reduce violent crime, create safer communities, and reform our nation's criminal justice system. BJA strengthens the nation's criminal justice system and helps America's state, local, and tribal jurisdictions reduce and prevent crime, reduce recidivism, and promote fair and safe criminal justice system. BJA focuses its programmatic and policy efforts on providing a wide range of services and resources, including training and technical assistance to law enforcement, courts, corrections, treatment, reentry, justice information sharing, and community-based partners to address chronic and emerging criminal justice challenges nationwide. Our current director, Carlton Moore, was appointed by President Biden in February of 2022. Next slide, please. And our work really focuses on providing funding through programs, transferring knowledge through training and technical assistance, developing guidance and resources, and engaging with partners and stakeholders all across the country. Thank you very much, and I hope you look forward to today's presentation. Now I'll pass it back to Dustin.
Thank you, Dr. Mount. The Council of State Governments Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association serving state officials in all 3 branches of government with policy and research expertise to develop strategies that increase public safety and strengthen communities. Next slide. We work by bringing people together, by driving the criminal justice field forward with original research, by building momentum for policy change, and by providing expert technical assistance. Next slide. Our goals include breaking the cycle of incarceration, specifically working with partners inside and outside of government to reduce crime and incarceration among youth and adults in contact with the justice system. Next slide. Our goals also include advancing health, opportunity, and equity, specifically by bringing people from diverse systems and perspectives together to improve policy and practice related to these challenges. Next slide. Our goals also include using data to improve safety and justice, specifically working to transform information into meaningful insights for policymakers. Next slide. The Council of State Governments Justice Center is committed to advancing racial equity internally and through our work with states, local communities, and tribal nations. We support efforts to dismantle racial inequities within the criminal and juvenile justice systems by providing rigorous and high-quality research and analysis to decision makers, and by helping stakeholders navigate the critical and at times uncomfortable issues that data reveal. Beyond empirical data, we rely on stakeholder engagement and other measures to advance equity, provide guidance and technical assistance, and improve outcomes across all touch points of the justice, behavioral health, crisis response, and reentry systems. Next slide, please. The Justice and Mental Health Collaboration Program, or JMHCP, promotes innovative cross-system collaboration and provides grants directly to states, local governments, and federally recognized Indian tribes. It is designed to improve responses to people with mental health conditions and substance use disorders who are involved in the criminal justice system. Next slide, please. We will now move on to today's guest speakers. Next slide, please. I would now like to introduce Jessica Tornabene, Senior Manager of Justice Diversion with the National Alliance on Mental Illness, or NAMI.
Thank you, Dustin. You could go to the next slide. So before turning it over to our NAMI speakers today, Nick and Luke, who will share more about the great work that they are doing in their communities, I just wanted to give a high-level overview of who NAMI is and the work that we do. Next slide, please. So mission and overview. NAMI is the National Alliance on Mental Illness and was founded 40 years ago by parents of children with mental illness who knew that there was a better way. We are the largest grassroots mental health organization working to improve the lives of people affected by mental illness. We represent people with mental health conditions, their family and loved ones, veterans, young people, and diverse communities. NAMI envisions a world where all people affected by mental illness live healthy, fulfilling lives supported by a community that cares. We work towards this goal by providing education, support, public awareness, and advocacy. For example, through our education and support programs, we have trained NAMI volunteers that bring peer-led programs and presentations to a wide variety of community and professional settings, including law enforcement. And since we have over 650 NAMI state organizations and NAMI affiliates throughout the country, you could reach out to your local NAMI for more information about these programs and other resources. Next slide, please. So since public policy impacts people with mental illness in many ways, one of the things we do at NAMI is that we advocate for changes that result in improved treatments, increased access to services, and better outcomes for people with mental health conditions. For over 30 years, we have been engaged in communities to change how they respond to people experiencing a mental health crisis. And you could learn more about our work to improve crisis response by visiting reimaginecrisis.org. NAMI also works with our grassroots advocates to influence policy at the state and local level and advocate with policymakers on the federal level to ensure the voices of people affected by mental illness are heard. Next slide, please. And here are just some links with additional information related to some of the things I talked about, as well as other NAMI resources that could be useful in your work. And if you have any questions, please reach out to us. Thank you.
Thank you, Jessica. Next slide, please. I would now like to introduce Luke Russell, Executive Director of NAMI Ohio.
Thank you, Justin. Thank you all for joining. I want to thank the Council of State Governments and the Justice Center for inviting us all to do this presentation and share the great work that many of us are doing in the criminal justice space around mental health. If I go to the next slide. So again, my name is Luke Russell. I'm the Executive Director of NAMI Ohio. We like to say we're the voice of mental illness in Ohio. And so we're very active. Our mission is to improve the quality of life and ensure dignity and respect for persons with serious mental illness. And again, this includes all the individuals, and I'll share here in a minute some numbers of those individuals that are in our criminal justice system currently or being diverted to them. And our main role here at NAMI Ohio, along with NAMI National, is we advocate, we educate, and we support. And that's really our goal and what we do. And we do that for, again, all people, no matter what setting they're in. And at NAMI Ohio, we have 38 active affiliates representing 79 of the 88 counties. And I like to say every day in Ohio, there is a NAMI program being offered, whether it's a support program, educational program, a CIT training, or some other lived experience participation. Next slide, please. So as part of this presentation, I'd like to share at NAMI Ohio what we're doing in the criminal justice space as it relates to mental health. And there's really kind of three different areas, and they kind of all overlap. Building partnerships with the right partners, and I'll share some of those moving forward. In those partnerships, advocating for community resources, and that could mean not just dollars, but also priorities and attention and time for people to be trained in certain aspects. And then also engaging peers in this work is always important. And like I said, as NAMI is the voice of mental illness in Ohio, we want to be in the at the table when decisions are made on how to best engage our criminal justice system as it relates to mental health. Next slide, please. So again, I just listed our mission again, and I put in all caps all. We know in Ohio there were 26,000 individuals that were in our state hospitals prior to deinstitutionalization. And what we do know is, and I've run these numbers and I've talked to folks, we've got over 10,000 individuals in our prisons, about 19,000 individuals in Ohio's jails, and roughly 5,000 homeless folks who all have mental illness. So what we have seen at NAMI is we've traded these state institutions for basically institutions that are really geared towards those that are in the criminal justice system. So what we want to do is we want to bring our lived experience and our family voice to how best we can engage the system. And here I've listed our kind of the 4 different key partnerships we have in Ohio at NAMI Ohio that we work with on a weekly basis, in some cases several times a week, that we work with to help hopefully move more and more folks into community-based treatment and out of jails and prisons and other settings that aren't appropriate. So, and again, all this work is done in partnership with our 38 affiliates. And as I go through this, in some cases, especially around CIT, some of our local NAMIs are the CIT coordinators in their community. So we're very involved with other NAMIs in our area. Next slide, please. So I'd like to first jump into our activity in the Stepping Up initiative. Obviously, this slide talks about the national effort around Stepping Up. And it talks a lot about basically where they are, what they're doing, who they've impacted. But in particular, the goal of Stepping Up is reducing the jail population through these cross-system collaborations and alternatives to crisis and diversion. So we work here in Ohio on, that's the main message. But if you go to the next slide. But particularly around Ohio, the NAMI Ohio, and we're involved in the Stepping Up initiative in Ohio, and we call it the Ohio Initiative, I think is on our sheets. But people in Ohio know who we are because there's such an effort being made across the state. in engaging counties to become stepping up counties, which means they'll work together with their local law enforcement folks and leaders in that community with a mental health group to come in and make a change. This was started in Ohio by former Supreme Court Justice Evelyn Stratton, and she is still very active. I don't know if she's on the call today, but she is a leader in this space, and she can get folks to come to the table. She still has friends on the court. She still has friends in the judicial system who are willing to come out to meetings. And this effort is funded by the PEGS Foundation here in Ohio, so that we actually have some funding to bring groups together to do this work. In Ohio, we're a very local run state. We have 50 mental health boards in the 88 counties, some of them multi-county boards. We have a lot of local control and rule. We have local levy dollars. And so a lot of our services and supports offered to those in the mental health system are by individual. So next slide, please. I'm going to show you just some examples of the Ohio Project and what we give to counties as we set up meetings. Last year, we averaged about, I think we did about 2 a month for 10 months. There were 20 counties that we engaged in the work that we were doing. Some of these are new counties who really don't have a great coordinated system of care for those in criminal justice and mental health. Others were revisiting them to see how they're doing in their efforts. And really, if you look at the efforts here, we provide all this information. These meetings, even in small counties, usually have about 35 folks. The county commissioners are usually involved, the county sheriff, a lot of times the director of the local mental health board, mental health providers, the local NAMI, obviously the state NAMI is part of the core team. We tag team with them on why they should be involved. And again, the project really focuses on, and I'm sorry for the print, but really, what are some of the assessment tools that can be used? What are some of the best practices out there? What technical assistance can be provided? And more importantly, to the community, what are some of the resources available to local communities to help them with the folks that are currently incarcerated? And a good example of that is we have a program for jail assistance for medication. And so they're grant funded programs. All they have to do is apply. They're going to get the money. A lot of counties don't know that. And then also, I think one of the other slides we'll talk about is we do sequential intercept mapping, where we'll offer to the community an opportunity to come in for a day or two and map out when somebody comes into crisis, how are they diverted, what's happening now, and what should happen. So, and a lot of that work is done with our Northeast Ohio Medical University, and I'll talk about them here in a minute. Next slide, please. And again, when you look across here, that map's a little bit old. I think 3 or 4 more counties have joined as a registered county. But a lot of this work is done by helping the judges and the county commissioners, the sheriff, all work together with the local provider network to kind of figure out how best to divert people out of the criminal justice system. And what we've seen in Ohio is an explosion of mental health courts. I think we have substance use disorder courts. We have veterans courts, places where people who may be suffering from mental illness show up, and how best we can serve them. So here's the 5 ways Ohio can help. And this is, joining our list of supporters. This is the community involvement, and I'll share some of the people involved. We have a toolkit we share with people. These are part of that, the slides. We talk about our visits and our convening of the leaders in that community. And this is where Justice Stratton is vital. She can bring in some of the biggest people in the community who make the decisions, like the county commissioners and the sheriff, and really have them involved. And what we've seen is they want to be involved. They want to be active, because what they're seeing more and more is, I use the 44% number in the jail, and I've had some sheriffs tell me their jail is at least 50% individuals with serious mental illness who are on a psychotropic medication. So they said, we're serving people in our jail, and the numbers seem to be growing. And then again, mapping out the resources within the community, making sure that the community leaders know where their agencies and other folks can go to get the help they need across the spectrum of care. And again, a lot of times we do about 20 meetings a year. We don't have any in December. I think there's one scheduled for January with a county. And again, these are a lot of initial work getting everybody there. And then once we have a county, we'll usually revisit them in 3 years to see how they're doing, usually after they've done a SIM, a sequential intercept map, to figure out if it's working, and if it's sometimes it's not working. Maybe there's new players involved, there's new folks, and they're not as engaged on the issue. Next slide, please. So part of the packet is every core member. There on my left of my screen is the NAMI Ohio. Like, that's our fact sheet we share. When I do my presentation, I usually do about 10 minutes or 5 minutes, and then I have our local NAMI share what they're offering. And again, NAMI services and supports are free. So we offer education and support groups. A lot of folks, even though they're in the same community, don't even know that. They don't even know we work with youth. They don't know some of the other programs that are offered, which would help reduce recidivism and also help family members survive when they're in the middle of a crisis. So we share who we are. Our other partners do the same. So, the CIT program presents, shares how to train officers, and I'll talk about that in a minute. We have the Ohio Department of Mental Health and Addiction Services. We also have the Criminal Justice Services, which is out of the Ohio Department of in the AG's office. They're involved. And as you can see, a lot of our core team working members are very committed, because we meet every Monday at 11 o'clock. Sometimes we go every other week to really plan out what the work we're doing in local communities. And then we also have some other state partners that aren't involved all the time, but their organizations participate in the county meetings. Next slide, please. The next area I want to talk about is crisis intervention team. You guys most of you are probably familiar. This is the training of police officers to better deal with individuals with mental illness when they come upon someone in a crisis. And these are some national numbers that come out of, I think, the Treatment Advocacy Center. And again, a lot of this information is online. In Ohio, we are very fortunate, like Stepping Up. Years ago, Northeast Ohio Medical Center got involved and really took CIT in Ohio to a new level. Next slide, please. And again, for those of you a little bit unfamiliar, CIT is really about getting officers not just trained and going to a training, but it becomes kind of a, when somebody calls NAMI Ohio and says, I have an individual in crisis, and they're threatening themselves or someone else, we always say, if it's going to be a law enforcement response, ask for a CIT officer. And I'll share in a minute why that's important in Ohio. So again, these are some of the things, improving the safety of everyone involved, including the officer and the individuals, improving the outcome, getting people stabilized, getting them the right treatment, getting them medications, and just increase understanding. And in this area, I participated in a CIT 40-hour training. Young officers coming in don't know a lot about mental illness. When they leave 40 hours later, after a whole week, they have a much better understanding. And then diverting people, which is obviously similar to the goal in Stepping Up. And then again, transforming the local response system, getting our law enforcement agencies involved in this work, because unfortunately they're on the front lines and have to deal with situations they may not be trained to do. Next slide, please. So our expansion here in Ohio, we've been very fortunate and well-funded here, both by the federal and state governments, to train officers. In Ohio, half of Ohio officers are CIT trained. And NAMI Ohio has a contract. We provide stipends, law enforcement, scholarships. We also do lived experience reimbursements for people to participate. We help our local coordinators, which is how the system is really run, because we are a local run state. There's a lot of local teams that work on this. What I really like is our partnership, not just with OMOS, which is our Ohio Department of Mental Health and Addiction Services, and their criminal justice division. They are very supportive of this work and participate on the core team. Northeast Ohio Medical Center, and they have the Criminal Justice Coordinating Center on Excellence. So they focus on this work. They lead it. They have a program director and a couple other folks who work with NAMI Ohio and law enforcement to set up trainings. And as you can see, since the expansion program started in 2019, we've really been able to put CIT on steroids in terms of the work that's being done. And we also, NAMI Ohio, we run the annual conference. We have a grant to do that, which is really unique situation. We have the Northeast Ohio Medical University Center, and we have NAMI Ohio, which were the lived experience family members, individuals. And then we also have law enforcement. There's a gentleman out of Kent State University, and he is the lead for law enforcement who had a three-legged stool to make sure we're offering the right programs. Next slide, please. And here's some of the impact that we have seen in this work, where really reducing the overall time spent on mental health calls. Honestly, almost every sheriff in Ohio and many of the major metro areas have now incorporated CIT into their academies and their training. So officers, when they first come, are trained in CIT. And I can tell you right now, I've heard from some of the folks who have gone through those academies come out, and it's the one thing they remember because it was so unique that they would spend some extra time talking about people with mental illness and their families and how we can better serve them. Somebody just put in here 260 patrol officers trained. No, I think that was the number of trainings in the 40-hour course. So long story short, we'll answer questions at the end. I'm sorry, I saw that question. I was like, yeah, we have refresher courses for those who have already gone through the 40 hours and then the 40-hour course. But again, what we've seen is, we know de-escalation works. Our court systems are even seeing more police officers who come onto a scene call their mobile crisis units right away when they know it's that if they have one, or they don't take someone necessarily to the ER if they're having a mental health crisis. They may take them to the local mental health center who has some sort of open door policy, or they have a crisis center. And again, these are just some of the things that we see. Again, like Stepping Up, NAMI Ohio, we advocate not only for resources, money, but also time to be spent by local law enforcement agencies to participate. And also we encourage these organizations to have the peer or those who lived experience present to the groups. Next slide, please. Our other partner has become the Ohio Department of Rehab and Corrections, and this is relatively new for us. But one of the things that struck us as we began to look at some numbers is the amount of people with serious mental illness in our prison. I happen to know the director, Chambers Smith of Ohio Department of Rehab and Corrections personally. She's a champion for the work that we do here at NAMI, but she's also a leader. And last year she instigated CIT for every corrections officer in her prisons will be trained in CIT. And when we were leaving the State of the State 2 years ago, I was there and we happened to be walking out together. And she looked over at me and said, we're the largest behavioral health provider in the state. And neither one of us should be happy about that, because they're a prison. And so next slide, please. So these are just some of the services that are being offered in our prisons. Many of these services that you see listed are very hard to get in the community. And again, at our March board meeting of NAMI Ohio, I have a 28-member board. We had the director of behavioral health for the Ohio Department of Rehab and Corrections present. And when we all sat here and looked at this slide that she presented to us, we were almost dumbfounded that you'd be better off getting services in our prison than anywhere else in Ohio. So we need to make sure we improve not only our community-based system, but the linkage to the community at discharge. Next slide, please. And this is, again, Ohio Department of Rehab and Corrections has this instituted peer support training, and we have 116 peer supporters. The nice thing about this is Ohio has begun to recognize this group and we can hire them in community mental health centers. So as people come out of prison and they're a peer supporter, they can actually get a job and they can work with other folks to help them in their recovery. Next slide, please. And again, this is just our partnership with them. These are some of the programs that they offer. And again, peers are involved. We do the lived experience. We actually have somebody goes to the CIT trainings. We have somebody in the prisons training folks on how to do peer-to-peer. And then our participation with them as they transition. And the last group we work with is really this is a unique group. Next slide, please. This is the AG, the Attorney General's Task Force on Criminal Justice and Mental Health. And if you notice at the top there, Justice Stratton is the co-chair of this group. This is an old slide. Our governor, who used to be the AG, started this group. And the focus of this group was really to bring people together and have a serious conversation at many, many levels on how best the state can engage in this work. In particular, again, you have leaders in the field on criminal justice, not just the AG, but some of the staff, people at Ohio Department of Mental Health. You have NAMI Ohio, and then we have some other folks, and I'll hit those here in a minute. And again, Justice Stratton is very involved in this. And now that she's retired, she can spend full time working on mental health issues, which is her passion. Next slide, please. And these are just, again, this was to address some of the issues around mental illness, and what the community was seeing was more and more folks with mental illness ending up in our jails and prisons. And Governor DeWine, prior to being the AG, was also a county prosecutor in a small county. And that's one of the reasons he formed this group, because he saw so many individuals coming through the Greene County judicial system who were mentally ill, and he didn't think they should be in the criminal justice system. They need to be in the mental health system. So he decided to do a statewide initiative. Next slide, please. And again, as being part of this co-chair, and I'm part of this group as well, these are some of the committees that are involved in the work. And there's probably at least 75 or 80 people. And I co-chair the policy and advocacy committee with or policy and legislative committee with an expert in this field that represents the prisons. Next slide, please. And then again, when we see this work, I mean, again, advocating for community resources, both at discharge and reentry. How can we do a better job? How do we achieve this? By leading individuals and family voices, usually around the biennium budget process, which is our main every 2-year funding cycle. Again, partnering with our local communities. That's the 50 local boards that are across the state, both their association as well as our provider association here in Ohio. And then again, our 38 affiliates around the state who work in CIT, provide lived experience. We have folks telling our story anywhere we can. They know to call NAMI when they need that and that work to be done. Next slide. So I've provided just my contact information. Feel free to email me. I'm kind of passionate about this right now. We've done a lot of work, but we still have a lot more to do. And I really want to thank you all for participating, and I'll stick around for questions afterwards. So with that, I'll hand it back to you, Dustin. Thank you.
All right, thank you, Luke. And as a reminder for everyone, if you do have questions for our panelists, please go ahead and put those in the Q&A box. And then when we're done with the presentations, we'll start working our way through those questions and give you all some answers. And I would now like to introduce Nick Richard, Executive Director of NAMI St. Tammany.
Thank you, Justin. And thank you, Luke, for all of that. Sometimes it's overwhelming to hear this. Just before I dive into our experiences, my role here is as the grassroots approach, right? Again, if you don't have a Luke in your community and you don't have a NAMI Ohio, we kind of came from a different perspective, right? So I've been the executive director here for December 1st is actually 15 years. And it sounds odd kind of saying that out loud. I really feel like I've only been here a couple of years, but I remember in the beginning attending NAMI cons and going to all these conferences and sitting there from this little community and hearing people like Luke talk about all these wonderful programs. And I sat there and I said, there's no way we're ever going to get to any of that, right? That's overwhelming. We're just never going to be able to reach that point. So my role is to give you guys the experiences that we had, hopefully building wonderful programs in our community. And in order to do that, I got to tell you a little bit about my community. So again, I'm in St. Tammany Parish. We're in Louisiana. We have parishes, not counties. We're the only state, in the country that does that. And our parish, a little bit about it. It's a community right north of New Orleans. It is a family community. It is historically known for having the best schools and being the most affluent in Louisiana. And yes, I know that's in comparison to other Louisiana parishes, so I understand the comparison there. But one of the other issues that we've had historically, Louisiana has long been known to have one of the highest rates of incarceration in the United States. And in that, our district in Louisiana, which is the 22nd Judicial District, was usually leading Louisiana in its rates of incarceration. So I come from a community that, while relatively conservative and reserved, likes to brag on our affluency in our schools. We have a high rate of incarceration. So just giving you that base level. Next slide. Again, NAMI St. Tammany, just a little quick overview. They always say if you've seen one NAMI, you've seen one NAMI. Our organization started in 1984, like many social service organizations. And from 1984 to 2005, it was a group of volunteer parents who came together to provide support groups in the community once a month. They all had children or loved ones living with a mental health condition. The budget for the organization for 21 years was right around $500. I mean, that was it, right? They had enough to make sure they had meetings going on. Fast forwarding to 2005, that was the year that our organization worked with the largest state inpatient psychiatric facility to bring forward the first, what would later be called peer support specialists. At the time, they were client liaisons and family liaisons who worked very directly with individuals at this state psychiatric hospital. Fast forwarding to 2008, they hired me, the first full-time paid executive director that the organization saw. And again, when I started, you know, we I think that year we had 1 peer support group, 1 connection support group, and 12 family support groups, and 2 family to families. We were reaching on average somewhere in the neighborhood of touching 150 to 200 people in our community. And fast forwarding to today, our regional impact in this community is we on average yearly, we're touching north of 30,000 individuals throughout the community. And that's through many NAMI things like education, support, answering phone calls, showing up to these presentations, and just helping people guide through the mental health system. When I started, we were around 3 employees. We're close to 35. And I want to highlight that almost half of those employees are certified peer support specialists. So how do we get to that, right? A lot of what we did for our growth, for our organization and impact in the community was through our mental health, was through our criminal justice system. One of the things we recognized real early on is the courthouse in most communities has a lot of things, but one of the things that it has is more elected officials than probably any building in our communities. Next slide. And with that became our journey into the criminal justice system from our affiliate standpoint. I'll do a quick story and then I'll kind of tell you where we're at. I remember I was only in this job for less than a year, so I'm in my late 20s, and I get a phone call, and someone on the other end says, you know, is this Nick Richard with NAMI? Down here we say Richard with NAMI. I said, well, yes, sir. And he said, well, I'm Peter Garcia. And I said, the judge? Why is there a judge calling me? It was a very intimidating place to be. And he said, well, I want to talk to you about some programs, and I've heard about NAMI and I want to talk to you. So we came in and he sat me down and he said, I want to start a mental health court. And the first line that I told him was, well, Judge, right now, I think that's a great idea. Let's get into that. But you have to know that right now we're in the middle of moving into Medicaid managed care. So we laughed about this years later, but essentially as a mental health advocate, I tried talking to a judge out of starting a mental health court. And that is just, that shows, I guess, the growth that we've had here. But Judge Garcia, we went on to work with Judge Garcia, who unfortunately passed away in 2020. And again, right, so we're in a community that incarcerates more people. We're in a community that's not favorable to social services, but we are also in a community that, because of the work of NAMI pulling in resources and meeting with local officials, we have 7 or 8 specialty courts ranging from drug courts, family preservation courts, veterans courts, sobriety courts, reentry courts. We have an AOT, and we have a newly established court intervention services, which is identifying individuals as they come into the jail to fast track people who are eligible for specialty courts. So we go from a community of being throw everybody away to now a community that has more helping courts and specialty courts than any district in the state of Louisiana. And how did we do that? We didn't do it. The community did it. What we did was we were NAMI. And one of the things that NAMI is incredible at doing is bringing resources. But one of the things we need to do more of, and we did, was we listened and we connect people. So I spent a lot of time with Judge Garcia, going through the criminal justice system, watching how the courts work. Again, my background's in mental health. I primarily help family members and people living with mental health conditions. So it was my job to sit there and listen and to see where the problems were. With that, we were able to bring peer support specialists who now work in every part of the court. We actually helped start a foundation specifically dedicated to raising funds for the specialty courts and their clients and raising awareness to the specialty courts. And all of that comes from sitting down and listening and working with our local officials. Again, this man was an incredible advocate and an incredibly passionate individual, and we were lucky to have him. And as you can see on the slide here, he was recognized by NAMI National as the 2018 Sam Cochran Criminal Justice Awardee of the Year, and he deserved that and he earned that. We gave him the information and the opportunity to do the things that he wanted to do. He always told me when he had people he would sentence, he would know, right? If you're in there for a drug charge or a mental health charge, and he would sentence you, that, as he would say, jail is not a therapeutic environment, right? Sentencing someone to jail is not going to help them with their addiction or their mental health condition. So he had to do something different. And he was a pioneer in our area to help make that different. Next slide. The other avenue that we looked at when dealing with criminal justice is obviously our sheriff's department. Again, as you heard earlier, I live in a community that wants to lock everybody up. It was a very difficult uphill battle from the grassroots angle. I remember requesting meetings with our sheriff, who was not this sheriff, the previous sheriff, on many occasions, and basically being ignored until I finally caught the ear of a captain who had a family member who was in crisis, who they leaned on us for. And I said, look, we got to bring CIT to you. This is back in 2012. We got to bring CIT. We got to bring CIT. We keep meeting. We end up leaning on our national organization, which I would say for anybody here, if you're a NAMI person, use your national organization, use the wonderful people here, use your other NAMI family to bring information forward. Well, of course, we were not able to bring CIT. We were able to bring in a modified, shorter training, because that's all our group would agree to. But what we did from there is we took the data from that training. We showed the officers who volunteered to take that training. We followed up with them. We developed relationships with them, and we brought forward a packet when the next sheriff's election was up. And one of the tricks we've always done here is, when there's an election coming up for a sheriff or a judge or anyone, we find out who's doing the forums, and we make sure that there's mental health questions in there. All right, it's one of the easiest things you can do as a grassroots advocate, because from there, obviously the candidates are going to have to speak on that, and once they speak on that, then you follow up with them. And once you follow up with them, you go, let me help you make that campaign promise a reality. And that's what we ended up doing here. In 2016, a new sheriff was elected, and we're fortunate enough to have a large gap. And we leveraged our advocate, Judge Garcia, who contacted the incoming sheriff. We then reached out to San Antonio community, and we took a trip with our local Human Services Authority director, a local parish official, our judge, and our sheriff. And we called their sheriff and said, hey, can we get these two sheriffs together? It's been one of the biggest tricks that we use in any level of advocacy is we put peers together, right? Because that's what NAMI does. We bring people together who have some of the same lived experience. Well, the same thing is true for any of the officials we work for in the community. And when the sheriff came back from that trip, he said, that's it. We're going all in CIT. When I get in here, we're going to do a CIT team. We're going to do CIT training. We're doing all these things. Now that's, 5 years after we've been banging our head on the wall to try and get these classes in here. Fast forwarding to today, just this year, we have our sheriff's office has decided to have a CIT team solely dedicated to CIT calls, in addition to having CIT trained officers on every shift. This year, we've trained more than 500 deputies in mental health first aid for first responders. And this all comes from a community that said, no, we're not doing this. We're putting people in jail. It all came from being together, getting to know each other, obviously, but bringing the resources from our national organization and our partners that they needed. And not, like I said at the beginning of this, not being so overwhelmed by trying to be Luke, right? And doing all the wonderful work that's happening in Ohio, and just taking the first step to have conversations and find out, what these individuals need. And again, the pictures you see here are, look at all these wonderful people in the community who are mental health advocates and law enforcement coming together because we recognize the work that they're doing. It's extremely important that you recognize your champions. They want to be recognized for this. Next slide. Right. So we talked about find your champion, right? Well, as I talked about in the beginning, our champion kind of found us, but we were open and willing enough to continue to work with him. We listened, right? Listening is one of the most important things that we can do. It's hard as an advocate to take on calls from people in crisis daily and to know the pain that people suffer when our society doesn't give them the services they need. But we have to put that aside and we have to listen. And then, of course, what we do, what NAMIs do, we provide support, resources, and data. Data is extremely important to show the value. Again, my line here is like, look, you can either care about people or you can care about money. I'm not here to tell you which one, but the services that we're doing here save taxpayer dollars. And of course, they're just simply the right thing to do. There's no one that can argue against doing these types of things, diverting people from emergency rooms and diverting people from jails. And again, building partnerships. Half of my job is to make sure that we're keeping the DA talking to the sheriff and the sheriff talking to the judge and the judge talking to the county officials and translating the information between all those people in the mental health system. Next slide. And support and resources. Again, I don't go into any of these courts or any of these sheriff's departments. I don't go any of these places saying, hey, look, what can you do for me? I go, what can I do for you? So do what NAMIs do. And if you're not a NAMI, you want her, reach out to your local NAMI, use the resources they have. We're able to have peer support specialists in a 5-parish region who give support to every single specialty court in a 5-parish region, which is a good portion of our state. We have peer support specialists and inpatient units all across the region. We have a day program where we're able to help people there, and we lead the crisis intervention team trainings. Another thing that we've been able to do is I actually personally ride along with our officers on the street. Because if I'm going to direct policy and I'm going to go to local legislators or I'm going to go to our parish officials and ask for change, and I need to know what these officers are going through on the ground level. These are the kind of things that humanize us, right? And this is what we learn in our CIT trainings. They humanize us and they develop empathy between all parties. So these are very easy, low-hanging fruit things that you can do anywhere in any community. And again, providing the resources. We heard, hey, well, we need more help understanding the system, right? So we're able to produce mental health guides that we pass out to our CIT officers and other individuals through the criminal justice system. They're posted in our courthouses. They're posted in our specialty court offices. They're posted in our sheriff's offices. And, we've actually recently, as a lot of NAMIs do, we put together a guide for family members in partnership with our local law enforcement professionals on what to do when you call 911, right? Because there are times where, unfortunately, you're going to have to interact with emergency services in a behavioral health crisis in certain communities. And lastly, one of the things I was really proud of accomplishing over the last 8 years, we actually produced a mobile app. We in writing with the officers, they had these little books, right? And they'd have resources in there. And of course, in the mental health system, we all know resources change daily. And from there, we actually were able to appeal to a foundation. We were able to get a grant. We were able to produce a mobile app wherein we can update resources daily. And if an officer is on a scene, they can actually take that resource, they can text it, and it's anonymous. It does not share the individual's number. Text it to the family member or the person in front of them to help guide them to a resource, which obviously helps diversion and gives the officers the tools necessary to not bring them to jail or the ER. It gives them the tools necessary to guide people to the most appropriate resources that exist. So again, I think my time is nearing on this. My role here was to give you a perspective and some stories from the grassroots level, and give insight into how individuals can approach. And I guess the last thing I would say is, if I could talk to myself then, at 28 or 29 years old, when I first started this job, is don't wait for somebody else to come in and do this. Don't be overwhelmed. Don't be intimidated. There are people in your community who care. There are people who are waiting to help. You need to be the one to lead, to reach out, to give them the information they need to start these initiatives. So again, with that, Dustin, I hand it back off to you. Thank you.
All right, thank you so much, Nick, for sharing the work that you're doing with NAMI St. Tammany. We'll now transition to Bill Carruthers, Executive Director of Grit and Grace Recovery Community Organization. And as we're swapping between slide decks, again, just a reminder, if you do have questions for our panelists, please do put them in the Q&A box, and we will circle back to those at the end of Bill's presentation. And a reminder, I've seen a couple questions. We will take this recording and it will be posted on our website, available within a couple weeks after this is done. So y'all will be able to come back and view this recording, as well as access all the links that are provided to each of the organizations that are presenting in additional information as well. And Bill, I will turn it over to you.
Wow, man. So thank you very much. First of all, I want to thank the council. I want to thank NAMI. NAMI has a special place in my heart. I was listening to Nick and to Luke. Nick and Luke rock. So my heart's clapping for you guys. It probably won't stop clapping for quite some time. NAMI has a special place in my heart because I was hearing all the things that NAMI does. NAMI was the vehicle that the first peer support engagement that I had was NAMI peer-to-peer. Now, I'll be honest with you, I came to NAMI because they said I was going to get a stipend. And that's the reason I came. I was just going to do that and leave. However, that was a number of years ago. NAMI sent me to the White House to speak. NAMI sent me to, I think, 8 international CIT conferences. NAMI educated me and exposed me to a greater world beyond those anonymous programs that I came into in recovery. So NAMI, my hat and my heart is off to you, man, because I know I wouldn't be where I am without you. I want to say thank you to Nora Haynes, who was the president of NAMI, who was the one that put the batteries in my back when I first came in. And also want to say thanks to Dr. Doreen Williams, who is a county commissioner here. And she is also the tip of the spear and leader of this whole mental health thing that we got going on over here in Rockdale County. Anyway, with that being said, as they said, I'm the executive director of the Grit and Grace, but I'm also the project developer for Stepping Up. What does that mean? That means that there's been quite a few sequential intercepts and quite a few planning and strategy and committee meetings. What that means is that I am part of a we, not just a me. And seeing that we and seeing those powerful people come to the table and that have a heart to hear, ears to hear, heart to hear the voice of recovery and want that to be alive on every level of what we're doing. That's what inspirational is like. I'm also a forensic peer mentor, which is a person who has a history of incarceration. But I think most importantly, I'm a person in long-term recovery. And what that means to me is that man, I'm living the dream. But what that means to you is that I have an extensive criminal history spanning 4 decades. I have an extensive addiction history that's probably longer than that. But that also means that for 15 years, I've been in recovery and haven't had the need for a drink, mind-altering drug, or any of those things. And it's during that 15-year period that people reached out, they engaged me, they believed in me, they trained me, they put the batteries in my back, and they gave me an opportunity not just change my lives, but change systems and change other people's lives. And that's the greatest thing that could have possibly happened, because a lot of people told me it wasn't possible and it never could. So the most powerful thing that all of us get from this presentation, and a lot of us brought it with them, I didn't have it, but I got it now, is just the belief that recovery is possible. With that being said, I'll talk to you guys about Grit and Grace. It's a recovery community organization, but it's also part of under our Stepping Up umbrella, which has a whole lot of components, but Grit and Grace is one, even though we're an individual 501c3. Anyway, could you go to the next slide, please? So our organization is obviously a 501c3 and is committed to recovery, but I guess the short version is no longer for us without us. It is obviously something that was designed by people in recovery, and it's for recovery, not just for people in recovery, but so that our entire community and systems can recover together, engage each other, have all these opportunities to interface, because there's no that us and them, y'all and us, that's just not the way it's going to work. This is a community problem, and there has to be a community solution. It's a we problem. It has to be a we solution. Anything else, that's just not going to work. So our philosophy is we want to do it with you, or we'll do it for you, but it's most productive if we do it with you, but it has to be done. And if it has to be, we'll do it without you. However, for the sake of best practice, together we are stronger. So Grit and Grace, obviously the name means something. We recognize that anything worth having takes hard work. That's what grit is. And we are grateful to have been given another chance to overcome all of those substance use, mental health challenges, trauma, drama, mama, all those things, and to reach our life goals by the grace placed on our lives. With that being said, could we go to the next slide, please? So since Grit and Grace has come into existence, in the beginning, we were just doing it off the muscle. Then we had the privilege of receiving funding from the Department of Behavioral Health and Developmental Disabilities here in Georgia. And that was a tremendous thing. But we didn't wait for the money to get here, because just like NAMI, and I think we probably caught that from NAMI. NAMI is contagious, because like Nick said, you can't wait for the money to get here, because the problem already exists, and your desire to do something exists. And you may not be able to do the great thing, but we can do a series of small things that will become great things in our lives and in other people's lives. So since we did get that funding, October 2022 to June 2023, we've had an opportunity to serve a large number of people. Can we go to the next slide, please? As a matter of fact, since that day, we've served 11,065 people. That may not be a lot to you, but it's a lot to me, especially when I thought I was in semi-retirement and I'll be the executive director, but I won't have to work every day. That's wrong. Anyway, I see a lot of people that get semi-retirement and retirement wrong. But there's not purpose. You can't get it wrong once you get it right. So we've had an opportunity to serve people both in person, digital platforms, and create a lot of community engagement. Because I'm gonna be honest with you, I was on the other side of midnight for a very long time, looking through a very biased and corrupted lens. I didn't know you were human, and you probably didn't think I was human either. So today we have an opportunity for people to come exercise that social learning theory, learn, grow, and change, eat together. We had an event not too long back, in our judges and all that. The judges were here, they were serving food, and obviously I was able to get on the mic and say to all the people in recovery in the room, you never thought you would be served a meal by a judge. And a lot of us have been served by judges, right? And so there's nothing like watching a judge eat with their fingers, because I thought they ate people. I didn't know they ate with their fingers. But anyway, with that being said, could we go to the next slide, please? So we actually started in 2020, right before the pandemic. And so when we started, and this is the reason why we started, we knew we were going to do some things, and we had our first listening session, and then they shut the earth down. But right before they shut the earth down, had the privilege of working with Dr. Deidre Hawkins, and we were doing a NAMI thing, and we were doing it on Zoom, and she did all the administrator stuff, and I just kind of was on the screen, just like, I don't know, doing what I do. And when we got ready, we got through with that on a Saturday. And I stopped and took a chance to look at the news, and I realized they're going to shut the earth down. So I went to our Supreme Court judge over here, and our Superior Court judge, and I said to her, because we were starting to work with the accountability courts, and I said, what's going to happen to the people if they shut the earth down? And I know that there was a plan to close the jails. There was a plan to close down the courts. There was a plan to close down the testing lab. And me as a person in long-term recovery, before my recovery, if the police were leaving, the judges were leaving, and there was no cup, man, that was a death sentence for me. And she said, what can we do? I said, I believe we can set up some Zoom platforms. I got the support from a lot of very smart people. And in 3 days, we were up and running with our first Zoom digital meeting. And we did that through the entire pandemic, doing it 2 times a day. And that was at 11 o'clock in the morning and 6 o'clock in the afternoon. And we have had 2 meetings every since. And then when we evolved into the building, we started doing those meetings simultaneously, or so that we were doing the digital and in person at the same time. And so with that being said, we've had the privilege of serving 38,806 people. That may not be a lot to you, but that is man, that's the greatest blessing, the greatest gift, the greatest privilege I've ever had in my life. And that is just a really, really, really fantastic thing because people have to get this thing we got. And I know you want them to have it. And so with this special, unique brand that we have, and I know people say, there's no new thing, but there are some new things. There's some very unique language that is very attractive to some people and very unattractive to other people. However, we'll get into that later. Could we go to the next slide, please? Another thing that happened when we got the blessing of funding, we were able to set up transportation, and we provided over 525 rides. And I know there was another slide, but anyway, we've done more than 525 rides, but everybody doesn't have a car. And if you've got something that is life-saving, we don't want to have to wait till people are in ambulances to come and get it, or they're in coffins going away because they didn't get it. And so I know that during this time that we've had this opportunity to do this, I've seen people, the people's process monumentally impacted by us just being able to give them a ride so they could get to this great thing we got. And that is a real privilege. With that being said, could we go to the next? As a matter of fact, actually, we've had over 673 rides, and that's with a savings of $16,248.85. And what that means is that is some money that some people don't have to get here, and that is some money that we have to find so people can get here. Another one of the things that we're attempting to do with the partnership of the Behavioral Health, DBHDD, or Department of Behavioral Health and Developmental Disabilities, in partnership with our commissioners and in partnership with the local Piedmont Hospital, we are attempting to get peer support in the ER, in the emergency room. And why is that important to me? Because I used to go to the ER and sleep. I used to go there and try to get some Darvocet and some Lorcet and Percocet and all those type of things. I used to go there when I owed people money and just to get off the street, and I would say I was a danger to myself or others. And I just really misused that system because some of the other things I needed, I just wasn't getting exposed to. And maybe, just maybe, no guarantee, but just maybe, if I would have had someone like me that could have said to me, there are some other options, and no, I'm not going to give you a appointment to get to it. I'm gonna actually give you a ride to it. And come on, let's get in the van. I'll show it to you. You don't have to take it, but you can see it. You can come over here. We got some coffee. We got some donuts. We got meetings going on. We got other people. We just have a casual conversation with no pressure. Or just that part. So we're really trying to make that happen, and it's happening in other places here, and the funding is happening in other places. So there's nothing that can happen anywhere that we can't do here if we do it together. Could we go to the next slide, please? Another big thing that we got going on is our jail curriculum that we're taking into the jails. Now, I know when kind of Nick was talking about, well, I remember when we had that first conversation, and we said we wanted to bring recovery in the jail, and they said who was going to bring it, and I said I was going to bring it, and they said, hold it, you got an extensive criminal history spanning 3 decades, and they said, well, I'm sorry, and we don't want you to take this personally, but we don't trust you to come to the jail. And I said, but you've been taking me to jail my whole life, so what happened now? But anyway, with that being said, that was then, this is now, and could we go to the next slide, please? At this point, we've had the privilege of having over 2,962 engagements behind that wall. And we do it both in person, and we also have simulcast into a couple pods at one time in another location, and we do that on Zoom as well. So we've had an opportunity, and there's nothing like it. There's nothing like it. And just in that partnership, well, they got RSAT and they got a lot of really, really good programs. But sometimes to be one, I need to see one. And when I was in jail, I remember the preacher used to come, and every now and then they would have the AA people come or the NA people come. And that was when I was in the county jail. But when I was in jail, I was in a part where ain't nobody coming. You know what I'm saying? Except the CERT team. But today, man, just having that privilege of representing recovery and letting people see the true evidence, because a lot of people say, I'm from Missouri, you got to show me. So let's show them. Why not? Right? And let's not just tell them what they should do, but show them what can happen if you do it. That is monumental. Anyway, could we go to the next slide, please? Another thing that we're doing over here on this side of the house, I know that a lot of people come in, they hear about it, they see about it, and they come to me, say, Mr. Bill, what do I got to do to become one? Why is that so important to me? Because I remember when I saw my first peer specialist, I didn't even know there was such a thing. And I was 50 years old, had been on earth for 50 years, and I had absolutely no idea that there was such a thing. Right. And I remember when I saw my first ones and I saw them and I asked them, what are y'all doing? Where y'all from? What do you, blah, blah, blah. Cause they had that unique recovery based language. They were dressed well and they smelled well. And they explained to me what it was. And I said, well, I know I can't be one because I got a criminal history. They said, no, you can be one. And there's a waiver. Well, at that time, they didn't have the waiver yet. But somebody, Nora and them went to the governor and got me a waiver before they instituted the waiver process. But later on, they actually put in a process so that people are evaluated. And if your criminal history, whatever that means, people that have criminal histories are probably more prime candidates for that level of employment than anybody else on the planet. So here at the center, we created this thing called Peer Support Prep. And just giving people information on how it works, some soft skills, because soft skills don't hurt. They don't even hurt hard people. And so I've seen a tremendous growth. When I first came here and I asked the commissioner, well, where's the peer support here? She said, well, there's this guy named Walter and there's another little lady, but she left to go work somewhere else because she couldn't make enough money doing peer support. And today, I think we got about 16 or 17 people, and we got peer support running all the way through all of these systems. So that is probably, that's the greatest possibility because there has to be a succession plan. Just like there's a succession plan for you, you may or may not know it. There has to be a succession plan that leads to greater. Anyway, with that being said, could we go to the next slide, please? So another thing we have here is the Opening Doors to Recovery Project, was a three-person intensive case management team that goes in the jail, meets people in jails. On some level, it's a diversion program because the judges love it, but it's that three-person intensive case management team. One person is a person in recovery, the other person is a person in recovery and a family member of a person in recovery, and the other person is a clinician. That three-person team partners with people for the minimum of a year to help them find safe, appropriate housing, adequate treatment, understand what a healthy, meaningful day is, and help them understand how to better use technology. Because you may not believe it, but a lot of us came out of prison and they invented cell phones and they invented chips and things were smaller, and I didn't even know how to work a remote. And let alone a computer. A lot of us only use computers for negative purposes, and we're very scared of technology, avoided technology, sort of like dinosaurs, and we know what happened to the dinosaurs. So this team has had incredible success. Those numbers that you see on the screen were just our beginning numbers. At this point, man, I've even got a guy that works here at the center who is our van driver and a support specialist who was part of that team when we started. So that works. And I had the opportunity to do it. As a matter of fact, Opening Doors to Recovery was built by Nora Haynes when she was inside NAMI. And that was about 13 years ago. And NAMI was the one that launched that program. And today it's an evidence-based thing. So once again, shout out to NAMI, man. Y'all rock. Anyway, can we go to the next slide, please? So why does that project work? And they had a randomized trial where they put intensive case management, they put ODR up against ICM, which is intensive case management. And you can see those statistics on the screen. 108 arrests under the standard case management, reduced to 39 under ODR. It saved like $2 million of, $2 million with standard case management. And then like $1 million point out off of that. What I think is really important or interesting, the four most common criminal charges found in this case study were probation violations, obstruction of an officer, disorderly conduct, and failure to appear. More people go back to jail for that than other stuff, right? How simple transportation fits into that metric, how intentionally engaging people in a way so that they don't avoid you when they're challenged. All of those things are so important in that process, and creating valuable relationships so that people see other people differently. You know, like I was saying, I had the privilege of speaking at all those CIT conferences. There was a time when I was allergic to law enforcement, or at least I thought I was. I wasn't really. I was just allergic to all that other stuff that I was doing. And so when I saw them, it kind of made me break out in hives. However, today, man, you just can't imagine some of the advantages. And one of the advantages is the Opening Doors Recovery Project. It has this built-in co-responder model, because everybody that goes into that project, we automatically enroll them in the Georgia Crime Information Computer Center system, so that if their name is run through a terminal on a police car, then we automatically get a BOLO or get a result. And then that way we are able to support that law enforcement person and also support the person, bring a lot of clinical information, because everybody signs these consent forms with their introduction into ODR, so the systems can actually speak on their behalf. And it really is a real asset. Can we go to the next slide, please? Another thing that we have the privilege of doing over here that I think is just the biggest thing since sliced bread, we have an opportunity to do a lot of pro-social engagement. And I was kind of sharing this before. Where I come from, I never saw one of those. I never sit down with one of these. I never talked to one of those. I'm allergic to them. Y'all are different. I'm this. I only hang out with people that are like me. And, you know, it wasn't hard for me to find people like me, because all of us were in jail or on our way to jail or doing jail stuff or having some near-death experience. Today, just sitting down and understanding that my circle of support are people that not only do I admire and respect, not only do they have multiple master's degrees and have a full wealth of knowledge that I tap into regularly, but they actually call me and ask me questions as well, which is still a bit amazing. But it's like something incredible happens when we're doing these healthy things. I never knew that there was a healthy thing. I didn't think that recovery could be fun. I didn't think that I could enjoy life. If I gave up trying to die, I didn't know I could enjoy trying to live. I just didn't know these things. Today, we're getting a chance to have them. We're getting a chance to do them. We're getting a chance to do them together. And I think I was sharing earlier, another thing we've had the privilege to do on this side. We have 3 co-responders models over here. We've got 2 that are embedded in the city police. We got 1 that's embedded into the county. And one of the opportunities that Grit and Grace has, because Grit and Grace is that place on the sequential intercept map that is at the very beginning before one, and it's at the end after. You know, it's where do people go when they're through? Where do they go if they're even trying to get in and avoid the perils of those systems? They can come here. So we have law enforcement that whip up, drop people off when people are challenged. Wow. Or when they're out there in the field and they're having that co-responder situation, they'll hit us up. We'll go out there, and just all I can say is, wow, it works, right? It works if you work it. Can we go to the next slide, please? So long-term recovery, we also have a very strong partnership with the accountability courts. We actually have a strong partnership with all of our providers in creating that continuum of care. So we have the Hope Dealers, which are the alumni from the accountability court. They meet here every 2 times a month on Thursdays. They come here, they do things. They not only do they enjoy themselves, but they prepare and do things for the community. They give it back every time that we have a graduation from one of those accountability courts, or other people have a graduation. They have a speaker bureau, and if you look on that picture, you see those fancy yellow things like when people graduate, and at the end it says Hope Dealers, and they're very proud of those. You can't even get one if you're not one of them. So, you know, but it's a distinction that a lot of people are very proud to have. another thing that we have the privilege of doing here, we have so many community-based programs. Our center is designed to support the community. So any good thing that's happening in the community, you can bring it here. You can do it here. We let our space, make our space available for no charge. As a matter of fact, everything we do here is free. So that's one of the advantages. A lot, if we let money, property, prestige, or personalities divert us from our primary purpose, then that is really unfortunate. So when we get beyond those things and we can provide these services and these connections, these engagements for free, then it really takes a lot of pressure off of both sides, right? So we have NA meetings, AA meetings, we got NAMI meetings, we have the Parent Cafe, which is for parents of children who are in school that are having challenges. We just have a plethora of things, financial education, financial literacy. We have every fourth Sunday, we have spiritual awakening where people come together and just really try to understand spirituality and the intersection between spirituality, religion, or whatever needs to happen for you so that you're not your own higher power, or that you can understand what higher power can mean in your life. And because recovery is not a destination, it's a lifestyle, and a lot of us are really living it. Can we go to the next slide, please? When we begin to have effective communication as partners, connect people to peers in recovery, and start to see a decrease in the familiar faces, we will know that we are on the right track, achieving our goals. With that being said, I can't see Rachel, but I know she can see me. So I'm going to say thank you very much for letting me share, and I'm going to turn it over to Dustin and Rachel and my esteemed colleagues.
All right, well, thank you so much, Bill, and thank you to all of our participants today. Trying to come at this from the national level with NAMI National, as well as from a statewide level, more of a county or parish level, and ending with Bill's presentation for an agency or an organization level. We'll now move into a period of questions and answers. If you do have any questions, feel free to go ahead and pop those in the Q&A spot. We have a few minutes left before we wrap up. But for our panelists, there is one question in there right now. Do you have any recommendations for a state government organization trying to implement a stipend program? We've hit some roadblocks. Thank you.
I'm not sure I can adequately answer that. We call ours a reimbursement. I know there's some issues about what you can and cannot reimburse, but for our stipend, our lived experience presenters, we will reimburse them for their costs. So, that's could be their time, could be their travel, could be whatever. We make it a flat fee, so it's a reimbursement in that sense. It's not like it keeps it simple. So that's how we do it with our CIT program, if that's the question. But I know there's some other federal and state dollars, depending on which dollars you're using for that, can be an issue.
Any thoughts or suggestions from any of our other panelists?
Yeah, I guess for me, I need a little bit more information on that, but the same, obviously, looking at what your federal and state laws are, and I recommend working with your local NAMI to maybe implement some of those funds. But we do the same thing that Luke does. Is it's flat rates based on all the federal and state standards.
Thank you both for that. Also had another question about where can I find information on the shorter CIT training?
This is Luke again. We only offer in Ohio to be certified. We have the 40-hour course, but we do a refresher course for those who have been through it. I think there also might be a one-day kind of introduction, but truly the CIT program itself really requires different elements. So it's hard to really cut out, like hearing distressing voices program, similar programs. It's hard to cut out, having someone with a lived experience share with the group. I mean, and then there's just what is mental illness? I mean, there's a whole half day on the definitions of what is mental illness, what's it look like? What are some of the symptoms if someone versus some other symptoms. So in Ohio, we just do the 40-hour, we do refreshers. That's really what we do here.
And again, if it's not 40 hours, it's not CIT. So, and I don't know if our NAMI representative wants to talk about this, but there's work being done, across this country to potentially look at some other types of trainings that can deliver in a shorter time frame. You're not going to get CIT in a short time frame. There's a reason it's 40 hours, and I've been doing CIT for quite some time. And again, to Luke's point, there's just so much of it. We've had people approach us, and like every law enforcement agency, right? They're 24/7 and they all have staffing issues. There's no such thing as a law enforcement agency that doesn't have staffing issues. So if you've worked in your community with law enforcement and they didn't say, can we just do it shorter, then you've never talked to law enforcement. I mean, that is what it is. So what I'd recommend people to do from what we did, again, I don't necessarily, we utilize mental health first aid for first responders, and then of course we utilize CIT for CIT. I'm not, I would just highlight utilizing CIT. It's there for a reason. It's been studied for a reason. And at this time, until things are worked out, that's your evidence base. That's your best course for 40-hour training.
Great, thank you. And see some comments in the chats with some links for additional resources, especially for finding your local NAMI. But a question possibly for Jessica: how can a nonprofit partner with NAMI to attend classes and learn how to provide programs to their programs?
Thanks, Dustin. And Shannon, feel free to jump in here, but that's why I really wanted to put the link in the chat in terms of finding your local NAMI. That's your first place to start. Like I mentioned, we have over 650 NAMI state organizations and affiliates across the country. So it's best to connect to your closest NAMI to learn about what types of programs and other resources that they're involved in their community. But Shannon, if I'm missing anything else, please jump in. Okay, she said perfect response. But yeah, Nick, Luke, I don't know if you want to add anything from, your experience.
I'll just real quick, I'll just add, in Ohio, our CIT program, we have CIT coordinators. So if you reach out to on our website, we have a whole tab for CIT. You can locate your county CIT coordinator. Sometimes that's a NAMI, sometimes it's a provider, sometimes it's one of our local ADAM boards, but we were involved. So I would reach out. Yeah, I mean, I think Jessica is correct. Just if you reach out to a local NAMI, they can probably connect you with the local group that's running NAMI. At least in Ohio, we have CIT coordinators in each county.
Yeah, again, I mean, I'm a CIT coordinator in my community, so I'm the person here, but I will always drive people back to the national organization. I know Jessica and Shannon do a great job of keeping us updated, but also connecting us. So again, go to the national organization. They're gonna know, they work with all of us in the field. They're gonna know where people are active and who to connect us to. So I know I keep kind of beating that one, but I would always reach out to our national organization. They're fantastic people, and they'll help direct you to the local champions in your community for this.
And if you need help making an introduction or whatnot, feel free to email us. I will drop our email in the chat so you have that as well.
Thank you all. And I would say one final piece of advice is don't be afraid to reach out and ask the question. It's apparent from all the presenters how interconnected they are with each other and with other community organizations and with others. So if you are looking to step up any of your initiatives, just start asking some questions, because there's a lot of connections that are happening in communities across the country. If we go to the next slide, please. Before we end, I wanted to highlight one additional resource that was just published by the CSG Justice Center, specifically about building successful partnerships with peer-run organizations. This is available on our website, but gives a little more insight and some practical advice about next steps. And then if we go to the next slide, These are just some additional links that may be helpful to NAMI National, Ohio Stepping Up Initiative, NAMI St. Tammany, Grit and Grace, as well as more information about the Justice Mental Health Collaboration Program, Stepping Up, which you heard quite a bit about today, and then the general CSG Justice Center website. And if we go to the final slide. Thank you again to all of our presenters and to each of our attendees for your participation today. After the session, again, the recording will be posted on our website, so that way you're able to access this information and access all those links that are presented in the highlighted resources. Please feel free to contact me if you have any questions about today's presentation. And as well, if you are looking to stay connected, please sign up for the Justice Center's newsletter. That is a great way to learn about new briefs, new information that the Justice Center is producing, as well as stay connected with upcoming webinars, communities of practice, and other learning opportunities that are out there. But as we close, thank you once again to all of our panelists for the excellent presentation today and the engagement. And thank you to all of our attendees for sticking in there, and I'm seeing a lot of great comments in the chat box. So thank you everyone for your time today.
Yay.
Have a good afternoon, everybody.
All right, you guys rock, man.